Hello, and thanks for joining us. My name is Dottie Howe, and I'm the Communications Director for the Ohio Health Information Partnership, the nonprofit organization that manages the CliniSync Health Information Exchange, as well as provides services through CliniSync Plus. We work with hospitals, physicians, and other healthcare professionals to make sure they're connected electronically and that information flows easily from one provider to another. Welcome to our series, Using Your EHR to Successfully Manage Patients with Hypertension and Diabetes. We've produced this video series through cooperative agreements funded by the Centers for Disease Control and Prevention. Its contents do not necessarily represent the official views of the Centers for Disease Control and Prevention or the Department of Health and Human Services. The Ohio Department of Health is working with us to help you manage your patients with hypertension, diabetes, or both conditions. Many of you already report measures on hypertension and diabetes through the Meaningful Use EHR Incentive Program or the PQRS program. Two of the most common measures, tracking blood pressure measurements for your hypertensive patients and tracking elevated A1C levels among your diabetic patients, are the focus of this video. Let's look at each of these measures separately before we explore how to capture the measures within your EHR system. The measure titled Controlling High Blood Pressure is known as NQF0018, CMS 165, or PQRS 236. Despite the different numbers, the measure is the same as to how it is calculated. When you want to know if your patients with hypertension are under control, you can run a report out of your system that will give you the number of hypertensive patients whose blood pressure is 140/90. This will be the numerator of the measure. The report will also tell you how many patients you have seen with a diagnosis of hypertension. This is the denominator. Your EHR system will automatically exclude individuals who have been diagnosed with end-stage renal disease, have had dialysis or a renal transplant, or are pregnant. The diabetes measure called hemoglobin A1C poor control is known as NQF0059, CMS 122, or PQRS 001. The numerator of this report will measure all your patients diagnosed with type 1 or type 2 diabetes whose hemoglobin A1C lab test was greater than 9% or who do not have any A1C results entered during the reporting period. It will compare this number to all your diabetic patients seen during the reporting period, which is the denominator. The number that is calculated is the percent of your diabetic patients who are considered poorly controlled. A lower percent is considered better because it means fewer diabetic patients are poorly controlled. Now, let's see how you can use your EHR system most effectively to manage your patients with hypertension or diabetes. Scott Mash, our Director of Consulting Operations and HIE Outreach, has engaged several practices to share with you their real-life experiences. These practices provide tips and suggestions about using their specific EHR. Although your EHR is only one tool that you can use in managing your patients with hypertension or diabetes, it's a highly effective one. Some of the items we'll be talking about include setting up clinical decision support rules and order sets to use for patients with hypertension or diabetes, documenting the patient's status during a visit, and managing patients between visits using patient reminders, patient lists, or clinical quality measure reports.
My name's Scott Mash, and I am here with Zach Hall from Memorial Health System that's located in Marietta, Ohio. How you doing this morning, Zach?
I'm good.
Let's just jump right in. Tell me a little bit about the EHR that you have here at Memorial Health System. How long have you had it? What modules do you have? And which locations do you use the EHR?
We currently have Meditech 615. We went live with it on November 1st, and we've switched from 607 And currently we have ambulatory module, which we use in all of the clinics, our outpatient clinics. We'll be going live with our physician's care, our 2 locations on May 1st. They'll switch to ambulatory from, I think it's the EDM module. We also have, 615 live with, all the other modules, Meditech, so like ARM, the ER modules, the OM, lab, ITS, our whole system uses 615.
So your Meditech on both your ambulatory side and your hospital side, so you have the advantage of having a shared database with all your patient clinical information. A lot to be said for that. Is there a means in the Meditech system for a provider or a member of their care team to view or generate their clinical quality measure report?
There's not a way for the front-end user to do it. Meditech does provide us with standard reports that our reporting team is able to use plug-and-play method, but it does require additional resources besides the front-end staff.
So somebody on your reporting team could generate these reports real easily for the providers and send them to them via email?
Yes.
So the intent of this video is to demonstrate EHR functionality that can be used to improve the outcomes and care of patients with hypertension and diabetes. The first part of improving the care of those patients is first identifying them. So can you show us where in your EHR you can view the problems or conditions?
Okay, so you can view a patient's problems by just clicking over here on the reference panel and clicking the chevron to expand problems. This will list the current patient problems, and if you want to dive deeper into viewing a problem, you can just click on the title of the actual problem name. Just click on the problem header and it'll launch the overlay of the problems. So from here you can click to expand it and it'll give you some detail. SNOMED codes, last activated, when it's first entered, and the last edited.
So you get a lot of detail on this one little screen. This is great. So if there were a problem that were not on the list, let's say I think this is test patients, so test patients tend to be very sick. I believe I already saw both hypertension and diabetes on this patient, but let's just show us how to add a new problem.
So if you want to add a new problem, you can click the search for, and we will add lower back pain. So once you type in some text in this box, it'll bring up a smart search, and if one of the diagnoses that you want to add is here, you can just select it from here. So we'll do pain in the lower back.
Now in that free text column out there, was that the ICD-10 code that was shown?
Yes. Pain in the lower back, it'll pull up, it'll display as on the top of the list. Again, you can expand it and add a comment, or if you want to add an onset date, you can click in the onset and put in a date. So you can do an exact date or approximate. If you do exact, it'll just change the formatting to usually today. And so.
Okay, the next functionality that we're going to look at is the ability to create a patient list by condition or condition. So does that functionality exist within the Meditech solution? If so, can you demonstrate it for us?
So we have patient registries, and it allows providers or office staff to compile a list of patients for a specific problem, and they're able to sort by last done the lab test or last office visit. It's really however they want to sort it to best suit their needs.
Well, let's create a patient list or a registry for diabetes patients.
Okay, so for the diabetic registry, it's a pre-compiled list, and from that list we can add them to like manual work list. So we'll go ahead and pull up the adult diabetic. Okay, so from here we can filter, do hide or show, and that's just going to let us set some like display options within the actual registry.
But this is a great view because this is your pediatric diabetes registry. But from this, you kind of get a summary of all those patients. Now, can you limit this list by the patients in the care of a specific provider or care team?
Yeah, so we can click. So we'll click filter. So if we only want to view diabetic patients for, say, Dr. Avery and Dr. Kane, we'll just select those two, click OK.
So this filter view is a really great view because you could, in theory, you could say, show me all of my diabetic patients that have an A1C out of compliance or they haven't had a test within so many days, correct?
Correct.
Let's take a look at a provider's specific view, select a few providers and take a look at the registry just one more time just to kind of see that wonderful summary view that you have available.
We've selected our providers and we'll hit filter. Filters all the providers out, or all the providers that we want to see patients for. It'll display, and now instead of 6,000 patients, we have 90.
So from this view, I'm guessing since you have the ability at the left-hand side of the screen to select patients, you could, in theory, be looking for a specific subset of patients, select the patients, and then perform some other action, correct?
Yes. So from here, we can select the patient, launch into the chart, and make a note, generate a task for the nursing staff to call the patient if they're overdue on something. You can also filter or sort by the A1C. All of these headers are able to click on them and sort. We can sort BMIs, blood pressures. We can scroll over, and it's going to have.
So you even have days since the last visit.
Yep.
That's awesome. So there's a lot of functionality here. The practices can get a good summary view. They can kind of treat it as a task list. The care team can really work towards ensuring that patients are compliant with both their needed tests and their follow-up visits. One of the features that is present in nearly all EHRs, thanks in part to meaningful use, is the ability for the EHR to identify patient education. Does the Meditech provide problem-based educational material? And if so, can you show us how to, let's say, access a diabetes education document that would then be provided to the patient?
Okay, so when the provider is documenting on the patient, after the visit, after they do the assessment and plan, and patient's getting ready to leave, they can click into the departure, and they're wanting to provide diabetes education. They start to type diabetes, hit the drop down, and it'll give them it'll list all the diabetes education that we have available in our system. And they can select it from there, and they're able to print out the print button, print out the education here, or they can do it at when the patient's checked out.
So part of the exiting process.
Yes. Yeah, they can print it from here, or they can print it at the front desk when they're checking out, making a new appointment.
So while we're on the topic of educational material, is there a means within Meditech to print out educational material around a newly prescribed medicine? So let's say you have a diabetic, let's go with a hypertensive patient. The patient was just prescribed atenolol, and the physician would like to provide that patient with some information on that drug.
So we'll add atenolol to this patient. We'll do a 100 milligram dose. Change the quantity. Give them a 30-day supply. And going to add the drug information. We can click monograph. Then it's going to display all the information about the drug. We can hit Q and exit to sign and save the order. So now that we hit Q and exit, we'll go ahead and hit save. And this will bring up the orders management screen. So we have the atenolol, and it's going to have the patient location where the patient is actually seen. We click print, it's going to launch into this screen with the print destination and what we actually want to print. And from here we can click patient mono, and that's going to print the monograph for that prescription.
Which is the very basic drug information.
Right. Print destination, select our printer, monograph printer, DM, and once we had selected all the printers that we needed to print this prescription and the drug information for the patient, we'd just click OK. It would send it to the printer, and we could hand them the script and the drug information.
A great time saver for the care teams that we see in nearly all EHRs now is the ability to utilize order sets. So does Meditech have the order set functionality? Do you have order sets created for hypertension and diabetes? And if so, can you show us how to use those?
Yeah, so we can click over to the order screen. If the provider has order sets set up, they'll display down here with a little star, meaning that's one of their favorites. You click to expand it. So you can click select, and I'll pre-select these lab orders. Prescriptions, you can expand it. So you can click in here and put the dose in. We'll do 100 milligram mouth daily, and we'll do a 30-day supply. We'll queue that and exit. We'll click save, and that'll launch the order summary screen, and it will ask us for a little bit more information for the lab orders. And once the specimen, so we'll do has been collected, and the problem, we will do hypertension. And by clicking here and filling it in, that did it for both orders instead of having to click each individual. And our atenolol prescription is up here to be submitted as well. So to finish this, all we need to do is click save.
And so now that we've seen how to utilize one of the existing order sets, let's say we wanted to add a lab or add a medication to an existing order set. How would we do that within Meditech?
So that's something that we do within our team. The providers don't have access to add this. It'd be they would request it, and then we would go in and add it. But we'll launch into Meditech, and within the clinical dictionaries and the ordering, we have the order set. So let's click here, And we'll edit the hypertension. So select the hypertension order set and click over to the Orders tab. Select our facility, and under the lab grouping, we can add or remove lab tests or service dates. Say if they want the lipid profile and the CMP done every month, but the CBC they want it done every 3 months, we can change that and save, and once we go back into ambulatory and order from that set again, it'll have the service date defaulted to 3 months instead of 1 month. If we want to add medications or diagnostic imaging, we can do that as well. Just click into here, click the drop down and diagnostic imaging as a grouping, and then we can add chest x-ray. Okay, and we can do the location default, so we'll do x-ray, select Marietta Radiology, and service date, we can do 1 month. And we can click save, and then once we log back into ambulatory and order from that set, the service date for the CBC would be changed to 3 months, and the chest x-ray would be an added test in there as well.
Perfect. Thank you. So in addition to having the order sets which are available to everybody at a site or everybody within the organization, does Meditech have the ability for a provider to have favorites that's specific only to them, but yet still serves as a shortcut?
Yes. So on the orders screen, the provider has already set up some favorites. They'll just, if they're favorite labs, they'll display down here under the lab header, and they can just click each test they want to order. TSH. So they can select the test they want to order from here, come up here, hit save, and it'll launch the order summary screen where they'll fill in service date, specimen query, and the problem. Or if they want to add a new favorite, go back to that.
So you link, all your orders get linked to a problem, as they should.
Yes. Okay. Yeah, they're unable to submit an order without a problem. So, and the problems are all linked to diagnosis codes. So, click exit, and we'll add a new favorite. So, if the provider wanted to order these 3 from his favorites, and he's been ordering a lipid profile on a lot of his patients, he would come up here to the search bar, search for it, and once he clicks save to launch back into the order summary screen, he would fill in the data or the information needed for this test as well, and we'll go ahead and fill it in, and then we'll save this one as a favorite. If the provider wants to save this as a favorite, all you'd have to do is click the star and save. So once he exits this chart, and once you launch back into a new chart, you'll notice the lipid profile would be saved as a new favorite.
Does Meditech have the ability to create condition-specific documentation templates, or is that a functionality you use within the system?
So Meditech does have the functionality for specialized templates. Currently, our offices are just using a general office visit template for the documentation.
So you haven't seen the need to create a problem-specific documentation templates, because generally the primary care providers are seeing the patients for a range of conditions, and they don't want to be locked into a specific set of data points that they're collecting.
Correct.
One of the essential functionalities within an EHR, especially for managing your hypertensive and diabetic patients, is the ability to send a reminder to a patient about an upcoming appointment, about a missing test, or even about an upcoming event. Can you demonstrate the workflow or the process to send a reminder out to a patient?
Yes, so within the Meditech 615 Web Ambulatory platform, we have a functionality that we're currently working on developing and rolling out to all of our clinics. It's called our patient registries. So here, within patient registries, you can have multiple different registries. So here we have listed our diabetic registry, which is going to pull in all of our patients that have an active diagnosis of diabetes. So as we click the registry, it's going to pre-populate all of our patients. So here we can see we have 30 pages, and we have a total of 600 patients. One built-in functionality is to be able to send reminder letters or any kind of letters that you wish. So by selecting here, it's going to select all of our 600 patients. You can see 600 of 600. So if you wish to send a mass letter to all of your diabetic registered patients, you can go over here by selecting the action button. From the action, you can select send correspondence. From here, you can choose a letter. From the drop-down search right now, what we have built and to demonstrate is our overdue registry items. So we would click in here, and then you can choose edit to show how the letter actually displays. So here it's just showing that we have a letter listed to, it's indicating that she may be overdue for her hemoglobin A1C. From here, you can choose to print the letter, or you can choose to print all letters, and as the letters are printed, they're also pushed to our patient portal and available through that routine.
So back to the registry. The registry that you had pre-built there was a list of all your diabetic patients that were overdue for an A1C, is that correct?
This is actually just a list of all of the diabetic patients. Here, if they had a hemoglobin A1C result, you would be able to filter the registry. So here you can choose how you'd like to filter it. So it's showing our empty cells right now, and you can filter this by showing I want a patients of hemoglobin this, or days since they have had a hemoglobin A1C, and then you would get a more concise list of the patients that you actually wanted to send that reminder letter to.
One important data item for the clinical team to access within the EHR, especially for a diabetic patient, is the labs. So can you show us how to access a recent lab test within the Meditech EHR?
So to access the most recent labs, on the summary screen of the chart, there's lab results, and this is just going to display the most recent. If we're looking at a diabetic patient and we want to look at the A1C, we can scroll down to the chemistry section and click hemoglobin A1C, and it's going to launch an overlay with the most recent result at the top, and it's going to list all results, for an A1C for the last 3 years or 5 years, whatever we want to change it to.
Is there a way to chart these values over time?
To graph them?
Yeah.
Yeah. So when we launch into the actual hemoglobin, the actual test, it'll display like this. We can hit graph, So we graph the results for the last year. Okay, so if you click on the actual dot on the graph, it'll bring up a little bubble with the actual results up here. That way it's easier to read, you know.
And so whatever one of those data points you click on are then highlighted there in that upper bubble.
Yes.
So are there other ways within the Meditech system that you can view the labs, other results, and related clinical information?
So from the main view of the chart, we'll click into flow sheets, and then we'll click the protocols button. So this patient has multiple protocols, so it's just going to display everything right now. And you can click right here and select which protocol we want to view. So we're going to select diabetic bundle.
Now when you're going into that drop-down list, this diabetic bundle is something that you guys created and set up to display certain data points that are clinically relevant to the diabetic patient.
Correct. So we're wanting to track, you know, on diabetic patient, the blood pressures, microalbumin, the LDL, and the A1C. The immunizations that we're tracking in the protocol is the influenza and the PCV13, the Prevnar. We're also looking at the smoking status, diabetic foot exam, so it's got the monofilament exam, peripheral pulses, and visual inspection, and the diabetic eye exam as well. And it's going to tell you if it was done and when it was last done and next due. So if we want to place an order for a hemoglobin A1C, we can click next due, and it'll bring up a menu. We can do the clinic performed, the office will result out, or we can do the A1C that gets sent to the lab and the lab result. We'll just do clinic performed.
When you say clinic performed, that's just the point of care testing for the A1C?
Yes. So once I select that one, it send it over to outstanding orders as to be signed.
So then to complete this order, then the provider would need to sign it, and then it would be released over to the lab.
Yes.
So on the previous screen, I noticed that we had a flow sheets button available. Can you demonstrate what the flow sheet functionality within the Meditech EHR actually does?
So the flow sheet is, we have multiple flow sheets set up, and it's just going to list, you know, whatever we're looking for. So in this case, we'll look at the laboratory flow sheet. Once it expands.
So we are looking at a test patient, and as is the nature of test patients within many EHRs, this is a very sick patient who has quite a large number of encounters. So we're really not seeing a lot of data here because of that. But really what the flow sheet is I'm guessing is just another summary view of a specific subset of clinical information.
Yeah, that's correct. So on this patient, we resulted a TSH the other day. As you can see, it's got the visit date and the result. And you're able to click into the result and launch the specimen report.
So really you have multiple avenues within Meditech to get at every piece of clinical information. There's a different summary screen or a different overlay, or just different ways for providers to group their information and access that information.
Yes, there's multiple ways to get into like the results, patient data, and every provider, every clinic, they do things a little bit different. It's provider preference, how he wants to access this information, but we try to hit all of them, make all options available for each one.
So the next functionality we're going to look at is the ability to access, view, modify family health history, because it is important for not only your hypertensive and diabetic patients, but for all your patients to, at least get an idea of what that family health history is and document it in the charts. Can you demonstrate how to access that information and how to make some changes to it?
So for the family health history, we'll scroll down to the PFSH section, and we will click the title to launch an overlay. And this will display their medical history, surgical history, family history, and social history. And it's just an overview. You can't edit it from here. But to edit the PFSH.
So PFSH stands for Patient Family Social History, correct?
Yes. So we'll launch into a document to make some changes to the PFSH. And from here, we will just click the PFSH header. So if we want to edit some family history, we'll click here and launch the overlay. We can view it by problem or by family member. If we want to add a new family member, we can add, say, brother. We can put, the brother's name, date of birth, deceased, if they're a twin, and then down here, this is going to pull up the current problems that's on the family history. That way, if everyone in the family's got the same, same problem, it makes it a little bit easier to click instead of having to type it in for each one. So we'll just do diabetes, and when we click the button with the arrow button, it'll expand it, and we can put age of onset. We'll just do 15. And we can put, if it's type 1 or type 2, and save. And I'll save that problem to the family history. So, and it'll display here with brother, diabetes, type 2.
Perfect.
Does the Meditech EHR provide functionality commonly referred to as a CDS rule, such as a pop-up reminder for a missing vital, or that a patient's overdue for an A1C, or for any other number of missing data items?
Within the ambulatory, there's really no pop-ups that's going to display if you didn't document your vitals, or if there's overdue testing or queries that need to be answered for specific protocols. They'll display in under the health management section, which tells you the protocols the patient currently has and the overdue items. So they're going to display here, and if it's a diabetic patient, it's going to look at the diabetic eye exam. For the depression, it's going to look at like the CBC, just whatever items within that protocol, if they're not addressed or if they're going to be overdue or currently overdue, they'll display in this section of the summary screen.
Is there a way from this summary screen that you can order an overdue item?
No, you'd actually have to go to the protocols to order that item. Within the protocols, you can click Next Due, but on the summary screen, you cannot.
Is there a way to edit the items that appear on the health maintenance screen?
From within the protocol screen, you can select the specific protocol and the items. You can inactivate if for a medical, for a medical reason the patient's refusing, or if it's just patient reason. You can inactivate the items, put that comment in, and it would display when you access the protocol again. It would display as great. It would be grayed out, and it'd have the comment and you'd have the ability to reactivate it if it was something that the patient decided they would go ahead and do. But that's done within the protocol screen. You can't do it from here.
So is there other functionality within Meditech that would be useful for managing all your patients, but specifically those with hypertension and diabetes?
Yeah, so we have a feature that we just started using recently. It's called My Widget, and it'll allow a provider to set these up on his own. If they see a high population of like diabetic patients, they can set in My Widget, they can set the results for like the A1C, the cholesterol. They can set these so it'll display on the reference tab or the reference panel, which is going to stay here throughout the entire visit.
So regardless of where the provider is documenting or what else they're viewing, this subset or this window on the right-hand side remains.
Yes. So this will remain there if they're placing orders, if they're in documentation, they're in the flow sheet, if they're looking at medicine or medications. This panel will display wherever they're at in the chart, and it's just a quick reference. So the provider would be able to look at this My Widget and see that the patient had an LDL that was done on January 6th, 2016. The provider has the ability to click into any of these results and pull up more detail. If it's a lab result, it's going to have the report attached to it, or a clinic performed point of care testing, it'll have the result.
And I also see here that next to the hemoglobin A1C, we have a status of pending. So if they have a status of pending, or if it's been too long since the patient's had one, or if it's been ordered and the patient hadn't went to get the draw yet, then the provider could, friendly reminder to the patient while they're in front of them, hey, go down to the lab as soon as you leave here.
Yes. Yeah. So if it's been a year and a half since they've had the LDL, the provider can remind the patient, you need to go, please go get this done. And they also have the ability to add results to My Widget. We'll add the BUN to My Widget. So all they'd have to do is right-click on the name of the test and click Widget. And it'll display on their widget now. They also have the ability to do Patient Widget, which if they are tracking certain items for this patient only, they would be able to do the same thing, just right-click on the name of the test, but they would click Patient, and that's going to highlight, Patient Widget instead of My Widget. And we can add the BUN to the Patient Widget as well. These will only show up for this patient, as where My Widget will show up for any patient the provider sees.
We thank you for your interest and hope this has provided helpful information. If you have questions, feel free to contact us. Scott's contact information is here. Remember, when working with your patient, it really is a partnership between your patient, your staff, yourself, and your EHR vendor. This team approach will ensure your patients will have the most successful outcome. Please be sure to complete the survey at the completion of the video, and thank you.